Intellectual disability, formerly known as mental retardation, is a developmental disorder characterized by significant limitations in intellectual functioning and adaptive behavior, which manifest during the developmental period. It affects an individual's cognitive abilities, communication skills, social interactions, and daily functioning. Here's a comprehensive overview of intellectual disability. 1. Definition: Intellectual functioning. Intellectual disability is defined by below-average intellectual functioning, typically indicated by an intelligence quotient IQ below 70 on standardized intelligence tests. Adaptive behavior. Individuals with intellectual disability demonstrate deficits in adaptive behavior, which include skills necessary for independent daily living, such as communication, self-care, social interaction, and problem-solving. 2. Symptoms: Cognitive impairments, difficulty with learning, reasoning, problem-solving, and understanding abstract concepts. Communication difficulties, challenges with expressive and receptive language skills, including speech delays, limited vocabulary, and difficulty understanding spoken or written language. Social impairments, difficulty forming and maintaining relationships, understanding social cues, and engaging in appropriate social interactions. Self-care deficits, limited ability to perform activities of daily living independently, such as dressing, feeding, toileting, and personal hygiene. 3. Traits: Wide range of abilities. Intellectual disability encompasses a spectrum of abilities, ranging from mild to profound, with varying levels of impairment in intellectual functioning and adaptive behavior. Individual strengths: Despite limitations in certain areas, individuals with intellectual disability may have unique talents, interests, and abilities in other domains. 4. Causes: Genetic factors. Genetic conditions such as Down syndrome, Fragile X syndrome, and other chromosomal abnormalities account for a significant proportion of intellectual disabilities. Prenatal factors. Prenatal exposure to toxins, infections, maternal substance abuse, or maternal illness during pregnancy can increase the risk of intellectual disability. Perinatal factors. Complications during childbirth, such as birth trauma, oxygen deprivation, or premature birth, may lead to intellectual disabilities. Postnatal factors. Brain injuries, infections, nutritional deficiencies, or environmental factors during infancy and early childhood can also contribute to intellectual disability. 5. Treatment: Early intervention. Early identification and intervention services, such as early childhood education, speech therapy, occupational therapy, and behavioral interventions, can help address developmental delays and improve outcomes. Educational support. Individualized education plans, IEPs, and special education services tailored to the needs of individuals with intellectual disability can facilitate learning and skill development. Therapeutic interventions. Behavioral therapy, social skills training, cognitive behavioral therapy, CBT, and supportive counseling can help individuals with intellectual disability develop coping skills, improve self-esteem, and manage emotional challenges. Medical management. Treatment of underlying medical conditions, management of co-occurring mental health disorders, and medication management may be necessary to address associated symptoms and improve overall well-being. Intellectual disability is a complex developmental disorder characterized by limitations in intellectual functioning and adaptive behavior. Understanding the definition, symptoms, traits, causes, and treatment options for intellectual disability is essential for providing comprehensive support and care to individuals affected by this condition.